Welcome to the deep dive. Today we're tackling a topic that many dog owners might face, or at least wonder about: female canine infertility.
That's right. We've gathered quite a bit of veterinary medical information to really explore why a female dog might have trouble conceiving, or carrying puppies, or even just having normal heat cycles.
Exactly. And our goal in this deep dive is really to give you, the listener, a clear picture of the potential causes, how vets figure things out, and, some of the ways it might be addressed. We're drawing straight from our expert sources here.
So let's start with what we even mean by infertility in female dogs. It's basically defined by things like abnormal cycles, maybe trouble actually mating, failure to conceive after mating, or losing the pregnancy along the way.
It sounds like a lot can go wrong.
It really can. And to understand infertility, it helps to first, quickly outline what normal reproduction looks like.
Okay, yeah, let's unpack the basics of how it should work.
So for a successful pregnancy, you need a whole sequence of events. A normal heat cycle, obviously, with healthy eggs being released, ovulated into a healthy reproductive tract.
Right. And then,
Then those eggs need to be fertilized by healthy sperm. After that, the fertilized egg has to implant properly in the uterus wall, a healthy placenta needs to form, and crucially, the pregnancy needs to be maintained, which requires high levels of the hormone progesterone for about 2 months.
wow, okay. So a breakdown anywhere in that chain.
Precisely. Any hiccup in that sequence can lead to infertility. We're talking primarily about the reproductive system, naturally.
And you mentioned this can happen at any age.
It can, but we definitely see it more often in older female dogs, say over 6 years old.
Oh, interesting. Why is that? What happens as they get older?
Well, one key thing is that older dogs have a higher chance of developing something called cystic endometrial hyperplasia.
Okay, what is that exactly?
Think of it as changes, sort of thickening and cysts in the lining of the uterus. This can make the uterus less welcoming, more prone to infections, and just not as good an environment for an embryo to implant and develop. Kind of like trying to plant a seed in unhealthy soil.
That makes sense. Are there other factors, maybe breed related?
Yes, there can be. For example, certain breeds are more predisposed to hypothyroidism. That's an underactive thyroid gland. Think golden retrievers, Dobermans, Dachshunds, Irish setters. Quite a few, actually.
Big boxers, poodles too, I think.
Miniature schnauzers, Great Danes, poodles, boxers, yep. And since hypothyroidism can affect reproduction, these breeds might show a higher rate of infertility, potentially linked to that.
So if someone listening is worried their dog might be infertile, what sort of signs should they look out for? What history is important?
A good history is absolutely critical. The vet will ask a lot of questions, like is she cycling at all? Is it regular? Are the times between cycles normal or really short, say 4 months or less? Also, has she been mated? Was there any difficulty? Do we know if the male dog is fertile? A big flag, of course, is if she fails to get pregnant after seemingly normal mating or gets pregnant but then loses the litter.
Any other signs?
Sometimes, though less common, a female might stay in heat, showing all the signs, for way too long, like more than 3 weeks. That's called persistent estrus.
And what about during a vet check? What might they find on a physical exam?
Well, the most straightforward finding might be a negative pregnancy exam after she was definitely bred. Or the other scenario is confirming she is pregnant, maybe with ultrasound or blood tests, but then no puppies arrive.
Right, the pregnancy loss. Okay, let's dig into the why. What are some of the common reasons behind infertility?
Okay, so first things first, especially with the dog you got as an adult, you always have to rule out, has she already been spayed? An ovariohysterectomy.
Good point, assuming she hasn't been spayed.
And then probably the most common reason, surprisingly, is just improper breeding timing. Getting that window right for ovulation and breeding, it's crucial and easy to miss.
Easier said than done, I guess.
Definitely. Beyond timing, though, other common issues are those uterine problems we mentioned, like a low-grade subclinical infection you might not even see signs of, or that cystic endometrial hyperplasia.
And the male factor.
Right, we have to remember it takes two. Problems with the male dog's fertility are definitely a factor sometimes, even though we're focused on the female today.
So timing, uterus issues, male factors. What else?
Underlying health conditions play a big role, too. Hypothyroidism, like we mentioned. Also hypercortisolism, which is too much cortisol, maybe from Cushing's disease or even steroid medications. Then you can have actual physical anatomic abnormalities in the reproductive tract she was born with, or even chromosomal abnormalities affecting sexual development. Sometimes the ovaries just aren't working right.
Any specific infections?
Yes, a really important one is Brucella canis. It's a bacterial infection notorious for causing infertility and miscarriages in dogs. And one more, silent estrus. She cycles and ovulates, but doesn't show the usual signs, so the owner misses the window to breed her.
That's a lot of possibilities. What about cats? Quickly. Similar causes.
Largely similar, yes. Things like uterine infections, CEH hormonal issues. But in cats, another factor is needing sufficient mating stimulation to actually trigger ovulation. And systemic infections, like certain viruses or toxoplasmosis, can also be significant causes in cats.
Okay, so given all these potential causes, are there specific things that put a dog more at risk?
Yeah, definitely some key risk factors. We already mentioned Brucella canis infection. That's a big one for dogs. Hypothyroidism and hypercortisolism, whether it's natural or from medication, are risks in both dogs and cats.
What about viruses?
Certain systemic viruses, yes. Canine herpes virus in dogs can cause puppy deaths and sometimes infertility. In cats, FLV and FIV are concerns. Protozoal infections like toxoplasmosis can impact both.
And general health?
Absolutely. Any chronic debilitating illness can affect fertility. Also, congenital vaginal problems, structural issues she's born with. And as we discussed, just being older increases the risk profile.
So when an owner comes in worried, how does the vet actually figure out which of these, if any, is the culprit? Walk us through the diagnostic journey.
It really starts and heavily relies on that detailed history we talked about earlier, really drilling down.
What kinds of questions?
Things like, did she ever have a heat cycle by the time you'd expect? That's primary anestrus. Or did she cycle normally and then stop? Secondary anestrus. Any previous pregnancies? If so, did she conceive easily? How big were the litters? Any stillbirths? Problems raising the pups?
Okay, so her whole reproductive past.
Exactly. Plus, any history of infections.
Right.
Was the mating definitely observed with a known fertile male? Was the timing potentially right based on her signs? Did tests suggest she ovulated? What about her thyroid status? It's like detective work.
And what about basic blood tests, like a CBC or chemistry panel?
Interestingly, often those routine tests come back completely normal in infertile dogs. They're important for overall health assessment, but they don't usually pinpoint the infertility cause itself.
So you need more specific tests?
Yes, definitely. For dogs, testing for Brucella canis is usually done early. There's a quick screening test, and if that's positive, you need confirmation with a more specific test like AGID or even culture or PCR.
Makes sense. What else?
Measuring serum progesterone is vital, hugely important. We track it throughout pregnancy. If levels are low, say under 2 nanograms per milliliter mid-pregnancy, that suggests the ovaries aren't producing enough to maintain it.
And high levels when she shouldn't be pregnant.
Right. High levels, over 2 ngml, could mean she's in the post-heat phase called diestrus. Maybe she had a silent heat, or potentially something abnormal like an ovarian issue producing progesterone.
You mentioned nanograms per milliliter. That sounds tiny. Accuracy must be key.
Absolutely. For interpreting those low levels, especially, quantitative assays sent to a lab are much better than the rapid in-clinic tests, which can be less accurate in that critical 2 to 5 ngml range.
Okay. And how does progesterone help with breeding timing? You said that was crucial.
It's the best tool we have. By tracking the rise in progesterone, we can predict ovulation pretty accurately. For instance, when it first hits around 1 to 1.9 ngml, ovulation is likely about 3 days away. If it's 2 to 2.9, probably 2 days away, 3 to 3.9, maybe 1 day away. And once it hits 4 to 10 ngml, ovulation is likely happening that day.
So you can pinpoint the best time to breed.
Exactly. The optimal time for breeding to maximize conception and litter size is typically about 2 days after ovulation occurs. But it's important to remember the day of ovulation relative to when she first shows signs of heat can vary quite a bit between dogs, and even cycle to cycle.
So you can't just count days from the start of bleeding.
Not reliably, no. Progesterone timing is much more accurate. And just quickly, in cats, we also use progesterone after breeding, but there it's mainly to confirm if ovulation was successfully induced by the mating. A level over 2 ngml tells us it was.
Got it. Any other key lab tests?
Sure. If infection is suspected, a bacterial culture from the uterus is ideal. We need to know what bacteria and which antibiotics work. Thyroid testing, T3, T4, TSH, is routine in dogs. We might test for herpes virus or toxoplasmosis if there's pregnancy loss.
What about genetic issues?
Yes, if a dog has never cycled, primary estrus, or just stopped, persistent in estrus, a karyotype, which looks at the chromosomes, can identify abnormalities. There are specific labs that do this.
Like Texas A&M or UC Davis.
Those are 2 well-known ones, yes.
Yeah.
You send in a specific blood sample. We might also check cortisol levels if Cushing's is suspected. And again, don't forget the male semen evaluation is often needed. There are also newer hormone tests like AMH combined with progesterone or L-estrogen that can help confirm if ovaries are present and active.
What about looking inside? Does imaging like X-rays or ultrasound help?
It definitely can. Standard X-rays usually won't show a normal, non-pregnant uterus or ovaries unless you have very advanced equipment. But if the ovaries look large, that might suggest cysts or even a tumor. If the uterus itself looks prominent, that could be a sign of fluid buildup or that cystic endometrial hyperplasia.
Are there special X-ray types?
Yes, we can do contrast studies, like a vaginogram or histogram, where dye is injected. That can reveal blockages or structural oddities. Ultrasound, though, is often even more useful.
How so?
Ultrasound is fantastic for diagnosing pregnancy really early, around 20-24 days after ovulation. It's also crucial for confirming loss of a pregnancy, watching the fetal heartbeats disappear, for example. And it's great for looking closely at the ovaries and uterus for cysts, tumors, fluid, thickening, lots of detail.
Sometimes do you need to go further? Maybe surgically?
In some complex cases, yes.
Yeah.
A laparotomy surgically opening the abdomen allows direct visualization of the reproductive tract and ovaries. And sometimes a hysterotomy actually opening the uterus is needed to get direct samples for culture or biopsy.
Okay, let's shift gears to treatment. Once you have a diagnosis, what are the options?
Well, treatment obviously depends entirely on the underlying cause we find. For cats, remember they're seasonal, so sometimes just ensuring adequate light exposure, like 12 plus hours a day, can help stimulate cycling year-round.
That's interesting.
And ethically, it's important to counsel owners, if the dog has something heritable, like maybe thyroid issues, should she be bred? Passing that on, that's a conversation to have.
Right. What about surgical fixes in dogs?
If there are correctable structural problems, like maybe a vaginal septum, surgery can help. Repairing blocked tubes is more complex, and the outlook for fertility is generally guarded. Draining ovarian cysts is sometimes done, but how effective it is long-term is a bit uncertain. If there's an ovarian tumor, removing that ovary, unilateral ovarectomy, might be curative, and future fertility depends on the other ovary being healthy and no cancer spread.
What if the cycles are just too close together?
For bitches, with those really short intrastress intervals, sometimes suppressing their cycle for 1 or maybe 2 rounds can help kind of reset things. And remember, if the only problem was bad timing,
Then the outlook is pretty good.
yeah, the initial prognosis is often good because improper management is so common. But if there are more serious underlying issues, the prognosis definitely worsens.
What about medications? Are there drugs used to treat infertility?
Oh yes, definitely. Antibiotics are key if there's a uterine infection, but ideally based on that culture and sensitivity testing we talked about.
So you use the right drug for the specific bug.
Exactly. For hypothyroidism in dogs, L-thyroxine medication is the standard treatment. You give it daily. But even if the thyroid level's correct, the prognosis for restoring full fertility is often still guarded.
Hormones.
Yes, gonadotropin therapy hormones like GnRH or HCG can be used. In cats, it might induce ovulation if mating wasn't enough. In both dogs and cats, it can sometimes treat ovarian cysts by making them ovulate or turn into luteal tissue.
Can you make a dog come into heat?
There are protocols for estrus induction, yes. Medications like diethylstilbestrol, bromocriptine, cabergoline, or deslorelin implants can be used, though that last one, the implant, has specific requirements about progesterone levels and needing removal later.
And suppressing heat.
There are meds for that too, like magistral acetate or mybelurone, with different doses depending on when you started in the cycle and the dog's weight. Mybelurone has some specific warnings, like for German Shepherds.
Are there times you absolutely should not use these drugs? Contraindications.
Very important point, yes. Progestins, like magistral acetate, are a definite no-no in dogs with that cystic endometrial hyperplasia or any history of progesterone-dependent issues, like certain mammary tumors.
Okay.
Mybelurone shouldn't be used in Bedlington Terriers or breeds with known liver problems. And critically, all these hormonal therapies are contraindicated if there's any chance the dog is already pregnant. You absolutely don't want to interfere with an existing pregnancy.
Makes sense. So once treatment starts, what kind of follow-up is needed?
Monitoring is crucial. If a dog is on L-thyroxine for thyroid, you recheck levels after about a month to ensure the dose is right. Ultrasound is key for confirming if treatment worked, confirming pregnancy, and then monitoring that pregnancy's health. And we might repeat progesterone tests to track hormonal status.
So listening to all this, it really hammers home that female canine infertility is well, it's complicated, not just one thing.
Exactly. It's really multifaceted. The causes range from something as simple as getting the breeding day wrong all the way to complex, hidden medical conditions.
And that really underscores the need for that thorough diagnostic approach you described. You can't just guess.
Absolutely not. That combination, the detailed history from the owner, the careful physical exam, and then using the right lab tests and imaging strategically, that's how you get to the bottom of it and figure out the best path forward.
This has been incredibly insightful. Thinking about how intricate the whole reproductive system is, it really makes you wonder, doesn't it? What other, maybe subtle factors might be influencing fertility that we don't fully grasp yet? Not just in dogs, but, across all species.
That's a fascinating question. There's likely still so much more to learn.
Definitely food for thought. Thanks so much for joining us for this deep dive.